12,000 deaths. While we are waiting for the president, we'd like to try to answer some of your questions, so please type them in the comments. Again, if you're just joining us, I'm Alan Piper, and you're watching NowThis daily live fact check of the president's coronavirus briefings. We are expecting the president at any moment, and we are expecting this could be a fiery briefing. The president has been increasingly erratic and hostile at this week's briefings. On Monday, he declared that as president, his authority is, quote, total, and suggested he could force governors to reopen states against their wills. For the record, this is false. On Tuesday, he announced that he's cutting off funds to the World Health Organization in the middle of a World Health emergency. Democrats say that this is not legal. On Wednesday, he threatened to adjourn Congress and govern the nation on his own. And then yesterday, he rolled out his plans to reopen the states, even though the governors and health experts of most states say that we're not doing enough testing to do this safely. He also, yesterday, falsely claimed that the number of new cases is going down. This is not true. While it does appear that efforts to flatten the curve are working and that the number of new cases is slowing, we are still continuing to add new cases. New cases are not dropping. And in fact, yesterday, the U.S. had its deadliest single day yet, with nearly 4,600 deaths in a 24-hour period. Yesterday, President Trump also suggested that we could get the economy roaring again, even while states like New York, New Jersey, and Michigan remain closed. These three states account for nearly 14% of the U.S. economy. Yesterday, he seemed to walk back Monday's statements about forcing states to reopen, saying that he would leave it up to governors. But today, he put a new and disturbing twist on that with a series of tweets that are widely seen as inciting violence in states he wants to open. He tweeted in all caps, "Liberate Minnesota." An angry mob has been gathering outside the Democratic governor's home. He tweeted, "Liberate Michigan," fueling protests against Michigan's Democratic governor, whom he has repeatedly mocked and belittled, despite the fact that she has put in place some of the most comprehensive protective measures in the country to defend against the coronavirus. He has called her Gretchen Half-Whitmer. That is his attempt at belittling humor. This week, Michigan protesters actually blocked an ambulance from entering a hospital. And perhaps most chilling of all, today he tweeted, "Liberate Virginia and save your great Second Amendment. It is under siege!" Exclamation point. Virginia's Democratic governor, who is also an actual doctor, has been saying that Virginia does not yet have the ability to do enough tests to safely reopen. And yesterday, an angry mob gathered outside his home. Beto O'Rourke responded to this Second Amendment tweet, saying Republicans will turn a blind eye and too many in the press will focus on tone, but history books will say in April of 2020, when the pandemic had already claimed 35,000 lives, the President of the United States incited people to storm their state houses with AR-15s and AK-47s. Also today, President Trump took to Twitter to insult crazy Nancy Pelosi. Mr. President, I want to point out that your insult game is really getting soft. You already used crazy on Bernie Sanders, and as for Sleepy Joe Biden, you already used sleepy on Chuck Todd. Now, the president also today spread lies about the Chinese death toll and President Obama's response to the swine flu. He claimed that China's new death toll exceeds America's. That is not true. While China has updated the final death toll in the city of Wuhan to a larger number than originally reported, it's still America first when it comes to deaths. we've lost more than 36,000 people to date. The U.S. accounts for roughly 20% of all the world's deaths. And as for the tweets about the Obama-Biden administration, President Trump falsely suggested that the death toll from swine flu under Obama was worse than what is happening with the coronavirus. That's simply not true, and the president knows it, so he is lying. In under 4 months, the coronavirus has killed nearly 3 times as many Americans as the swine flu killed in an entire year. Furthermore, the Obama-Biden team learned from the swine flu. They created a global health security unit within the White House National Security Council. Trump fired that team. They created a 69-page pandemic response playbook. Trump discarded it. So that's where we are today. And if you're just joining us, I'm Alan Piper, and this is our live daily fact check of President Trump's coronavirus briefing. All of us at NowThis are self-isolating and working from home. I'm broadcasting from my apartment in the East Village, so please forgive any technical difficulties or if I get Zoom bombed by one of my cats again. We are expecting the president at any moment, but in the meantime, I'm going to look to answer some of your questions. Please type them in the comments. Now, this is April 17th. This is the day that Treasury Secretary Mnuchin said that everyone would receive their COVID relief payments by. A lot of people have gotten them, but a lot still have not. If you usually get money back from the IRS via direct deposit, that's how you should be getting this payment. It's $1,200 for most middle to low income Americans. Direct deposit is great if you have a bank account. Unfortunately, roughly 15 million Americans don't. Low income workers, most in need of the relief, are the least likely to have bank accounts, and as a result, they'll have to wait the longest for these checks. The IRS says that it could take until September to get all of the physical mailed checks out. And at least a few extra days have been added to this because President Trump reportedly insisted on having his name printed on the checks. Again, if you are just joining us, I'm Alan Piper, and this is NowThis live daily fact check of President Trump's coronavirus briefings. We are expecting the President of the United States at any moment, and in the meantime, I invite you to leave questions in the comments, and our team will work to pull them and help us answer them for you. I'm just looking at these numbers, the latest numbers for today. While we're collecting your questions from the comments, I want to walk through a little bit of the timeline of what has been going on with this crisis. Because the president has repeatedly tried to rewrite the timeline of what is happening. Actually, I'm going to take one of your questions now. Rhonda asks, how can states reopen when we still do not have adequate testing? And Rhonda, you are asking the million-dollar question. Yesterday, President Trump announced that states can decide themselves when to open. However, experts say that the country needs to significantly increase its testing capacity because it gives officials the ability to find out where we stand in fighting this disease. It gives us the ability to track and isolate sick individuals. And experts warn that easing social distancing measures before increasing testing could result in more deaths. And in terms of the president's argument that, well, it's the economy above everything else, you can't have a functioning economy when people are dying or in fear of dying. In fact, many economists have warned that if you reopen too quickly and people find that they're not safe, that then it will become harder than ever to lure people back into public spaces because they simply will not feel safe. And it will add months to the recession that is arising out of this. And most importantly, it will add thousands of more deaths. April asks, didn't I read that sparsely populated areas are showing an increase? And the answer is yes. There have been small but significant spikes in COVID-19 cases in rural areas. It is especially striking that in states without stay-at-home orders, they've said, well, we don't need them because we don't have a lot of cases. Well, they're starting to have a lot of cases because they didn't put stay-at-home orders in place. Just in this past week, Oklahoma had an increase of 53%. Arkansas had an increase of 60%. Nebraska had an increase of 74%. Iowa had an increase of 82%. And South Dakota had an increase of 205%. This trend undermines the notion that President Trump perpetuated and that some of his Republican allies have been putting forward, that there is not a need for social distancing in rural areas. Also, in a lot of instances, this may well be the result of churches that insisted upon holding Easter services. We already have been seeing that a large number of people who have been going to church services, exposing themselves to other people, have indeed been becoming sick. And that is tragic. All right, I'm being given some updated numbers here. Just getting these numbers loaded in. Again, if you are just joining us, my name is Alan Piper. I'm the senior politics producer for NowThis, and I am joined by an entire newsroom of people who are working remotely here in New York City, the global epicenter of the coronavirus pandemic. Here in New York City, there are over 123 cases. We have lost 13,000 of our citizens to this disease. In the U.S., we are getting close to 700,000 cases. All right. We lost you for a moment there, but I think I am back. Sorry about that. Again, we are broadcasting each from our own homes, so I am relying upon my own personal internet connection to get this broadcast to you. So, as I was starting to say, there are 692,000 cases of the coronavirus in the U.S. Today. This is an increase over yesterday of nearly 40,000 more. So let's remember, President Trump is going to suggest, again, he's most likely going to say that we are having fewer new cases, and that is misleading. While the number of new cases added each day may be slowing because of our efforts to social distance, we are still adding new cases. That's 40,000 new cases since yesterday, and without widespread testing, we cannot know for sure how many there really are. So Pam asks, is there still a possibility? Pam, you're asking an interesting question. There is, you're asking, is there a possibility that this virus is connected to a lab in China? This is an idea that Secretary of State Mike Pompeo has seemed to be floating. Scientists, researchers, doctors, and immunologists have said that the virus is the product of evolution, not of synthetic creation or lab manipulation, as some conspiracy theories have suggested. As outlined in an article for the journal Nature Medicine, a group of researchers found that this virus is indeed the product of natural evolution. One of the researchers, Christian Anderson, told Science Daily that the mutations in it's a lot of technical stuff that doesn't even necessarily make sense to most of us, but apparently they can tell by looking at the protein breakdown of this virus that this could not have been the result of laboratory manipulation. This is naturally occurring. So let's not confuse this with Captain Tripp's disease from Stephen King's novel The Stand, which was created in a government laboratory. That is not the case. All the scientific evidence suggests that this is a thing that naturally occurred. And in fact, there were warnings that such a thing could happen. The Obama administration warned the Trump administration coming in. Obama's outgoing national security advisor, Susan Rice, warned the incoming security team of Donald Trump's that the biggest threat that she perceived, or at least one of the biggest threats that she perceived, was the risk of a global pandemic. She personally handed off the 69-paged pandemic response playbook that the administration had put together because it seemed so likely that something like this would happen naturally. So although this feels like something out of a science fiction movie, this is not, according to the science, something that was manufactured. It is just a tragic natural occurrence. So if you're just joining us, my name is Alan Piper. I am the senior politics producer at NowThis. The president is late. I'm going to check his Twitter feed to see if I can find out what he is up to and what is delaying him. It is often a very good way to track down what the president of the United States is up to. Okay, no new updates right now. Earlier today, he ridiculed Governor Cuomo, the governor of New York, saying it was ridiculous that he wanted as many ventilators as he wanted. I'd like to point out that New York State has nearly 250,000 cases of the coronavirus. New York State not only has more cases than any other state, but more cases than any other country. So it is not ridiculous that the governor of New York was looking for a lot of ventilators. So I invite you to please type your questions into the comments. We are expecting our commander-in-chief to walk through that blue door at any moment and greet us with news. But while we're waiting for him, we will take your questions. And I'd like to walk through the timeline a little bit of where we are. Because President Trump likes to say that no one could have seen this coming and that no one could have acted as quickly as he did. I just highlighted some of the things that the Obama administration did in its time to try to prepare for this. In 2017, reporting from The Nation reveals that the Pentagon flagged to the Trump administration in the first year of Trump's presidency that there was a potential shortage of masks, hospital beds, ventilators, and other equipments, and warned that there could well be a risk of an epidemic disease and that the administration should prepare for it. It did not. The following year, 2018, was when President Trump officially fired the pandemic response team that President Obama had put together in the National Security Council. President Trump also let funding lapse to the CDC's Epidemic Prevention Unit, causing it to downsize in 39 countries, including China. Would have been nice if the CDC had had a larger presence in China at the end of 2019. We now know from reporting from ABC that as early as November, intelligence officials began to warn the administration that there was a dangerous new virus coming out of China. And Reuters reports that in December, the White House National Security Council was briefed for the first time about the danger of the disease. Now we'll continue with that timeline, but I want to answer some additional questions. A lot of people are asking if this check that you're supposed to be receiving, this payment that you're getting in your bank account, is that a loan that you have to pay back, or is that yours to keep? It is yours to keep, and it is not it's not taxable. Now, Treasury Secretary Mnuchin has said that $1,200 should be enough to keep you going until the economy reopens. I got to tell you, here in New York, $1,200 does not pay a month of most people's rent, let alone cover all expenses that they might have until we end social distancing. We have seen the first members of the task force arriving in. I see Agricultural Secretary Perdue. I see Center for Medicare and Medicaid Services Administrator Seema Varma. I see the Director of the CDC, Robert Redfield. Dr. Deborah Birx and Dr. Tony Fauci are here. We are still awaiting the President of the United States. All these members of the coronavirus task force team are standing directly next to each other. They are not social distancing. They are not wearing masks. So the President's team is continuing not to demonstrate its enactment of its own guidelines. The guidelines that the administration has put out on social distancing are wise. You should follow them. You should do as this administration says and not as it does. Although don't do as it says on everything, because the President likes to suggest that people should start taking certain medications without the advice of a consulting physician, and that's not something you should do. And here comes the President of the United States. We will fact check him as he speaks.
Thank you. Thank you very much. I just had a great conversation with the leading faith leaders of our country. It went extremely well. We learned a lot. I learned a lot, and we're working on some things that are very interesting and very positive. I thank them all for being on the call. And yesterday, we unveiled detailed guidelines for America's governors to initiate a phased, safe, and gradual reopening of America. That's what's happening. The guidelines provide governors with the fact-driven and science-based metrics they will need to make the decisions that are right for their own particular state. To view the guidelines, you can go to the website at whitehouse.gov/openingamerica.
Now, these guidelines that the President's referring to relate specifically to whether or not there are more new cases in each state. Now, the problem is that the governors of almost all the states have said that they don't have enough tests to be sure of that information.
An incredible success it has been. If you have not received your check, please visit irs.gov, get my payment. How about that one? irs.gov, get my payment. That way the IRS can get you your payment in days, and they've done a fantastic job, I have to say, and you won't have to wait for a check in the mail. I have some very good news. We sent out 80 million deposits, and less than 1% had even little problems. A couple had minor glitches, but it's substantially less than 1%. So out of 80 million deposits, less than 1%, and that gets corrected immediately. So just please do as I say. You'll get that very quickly, very easily.
So Treasury Secretary Mnuchin had promised that all payments would go out by today. Many people have received the payments, but not everyone, in fact, has. And those people waiting for physical checks are going to have to wait a little bit longer because President Trump has reportedly required that his name be printed on all of them in an unprecedented move.
Our farmers, ranchers, we have, these are great people, great Americans. Never complain. They never complain. They just do what they have to do. The program will include direct payments to farmers as well as mass purchases of dairy, meat, and agricultural produce to get that food to the people in need. The USDA will receive another $14 billion in July that will have funding to continue helping, and this will help our farmers and our ranchers, and it's money well deserved. So not only were they targeted at one point by China, and that was over a period of time, and you saw that happening, and they never complained, but that worked out very well. $12 billion they got, and $16 billion they got, and now it's $19 billion, and I'm just going to ask Secretary Perdue to explain exactly how we're going to handle it. Thank you.
Well, Mr. President, you may remember earlier this year you tweeted a message to our farmers and ranchers that no matter the circumstances, you pledged to stand behind them. And while none of us could ever have anticipated this type of pandemic that we're currently in, I think today's announcement is proof that you have our farmers' backs and that you will continue to do what it takes to support them, and they are very grateful. We've heard a lot.
The farmers have been suffering in part because of the trade war that President Trump initiated with China. President Trump imposed tariffs on Chinese goods. China retaliated by imposing tariffs on soybeans and other U.S. agricultural products, which has led to a loss of profits for farmers, and President Trump has had to actually do a taxpayer-funded bailout for the farmers because of the lost revenue from the trade war that he started with China, which he repeatedly phrases as something that's causing more money to come into the country, but it actually is not.
COVID-19 national emergency. The program is really divided into two parts. One is a direct payment, $16 billion in direct payments to farmers, ranchers, and producers who've experienced unprecedented losses during this pandemic. Since we wanted to get the payments out to producers as quickly as possible, we decided to use the funds in the CCC, the current funds of $6.5 billion, combined with the 19.5 of COVID money, rather than wait for the replenishment of the CCC funds in July. Based on industry estimates of damage, Mr. President, it is becoming apparent that we'll need the additional CCC funds as we continue to track the economic losses. Secondly, and this is really important as well, the USDA will be purchasing $3 billion in fresh produce, dairy, and meat products to be distributed to Americans in need through our food bank networks, as well as other community and faith-based organizations. Having to dump milk or plow under vegetables ready to market is not only financially distressing, but it's heartbreaking as well to those who produce them. This program will not only provide direct financial relief to our farmers and ranchers, Mr. President, but will allow for the purchase and distribution of our agricultural abundance in this country to help our fellow Americans in need. So in recent weeks, all of us have seen the heroic patriotism of our food supply chain workers that have shown day in and day out doing the work to serve the needs of fellow Americans.
I want to point out that our food chain supply is made possible by certain members of the economy that President Trump has been specifically excluding. Roughly 1 million of our farm workers are undocumented immigrants whom we depend upon for our food, and the store and restaurant workers who have been keeping us fed are largely minimum wage workers. President Trump has fought hard against raising the minimum wage. In fact, he has sought to lower it. Get rid of it altogether, that is. So that was Secretary Perdue, the former governor of Georgia. As governor, he signed a law giving himself a tax break, and when he was found to have violated Georgia law by funding his campaign accounts with contributions from his private enterprises. He also has been a climate denier, so bear in mind that he is part of the president's scientific team here.
Visible enemy. To date, we have conducted more than 3.78 million coronavirus tests, by far the most of any country. It's not even close. In the hardest hit areas such as New York and Louisiana, we've also tested.
There's a lot that's wrong in that statement. For starters, I believe it's only 3.5 million tests, and while it is a large raw number, it lags far behind most nations in testing per capita. We rank around 42nd in the world in testing per capita. The testing is what's essential to opening up the country. Germany is on track to get the country open again because they have widespread testing, which we do not.
It's the hot one. Problem with this business is it's a hot one till about 2 days from now, because we do have a saliva test that just came out, and that can be self-administered, and it's said to be fantastic. I want to thank Abbott Laboratories. They have been incredible. I want to thank Roche. They've likewise been incredible. Over the last several days, we've seen a dramatic increase in the number of tests conducted by hospitals and academic institutions, which have now performed nearly 600,000 tests. There's a tremendous amount of unused capacity in the states available for governors to tap. We have tremendous unused capability within those laboratories, and I hope the governors are going to be able to use them. The governors are responsible for testing, and I hope they're going to be able to use this tremendous amount of available capacity that we have. It's up to
so the president has repeatedly tried to cast blame on the governors for the fact that we don't have enough testing. It simply would not be possible for governors to be prepared for this level of testing. There's a reason we have a federal government. National emergencies are exactly why we have a federal government. As Governor Cuomo responded in his briefing today, he explained, I can't do an international supply chain. Anyway, I'll give you back to the
antigen and U.S. cotton to greatly expand the supply of essential swabs, including a new polyester Q-tip type swab for the coronavirus testing. All of these actions will help our testing capability continue to grow dramatically. So we're helping people even with swabs. We get ventilators. We're now the king of ventilators. We have hundreds of thousands under construction. We don't need them ourselves. The governors are in great shape. If we do, we have a great stockpile that will immediately.
This is not true. There are not enough ventilators for the need. We have reported on people who have been in hospitals where doctors have had to decide which patient gets a ventilator and which is left to die. In New York, there are at least 4,600 people currently on ventilators. A classmate of mine from college recently came off a ventilator and has really driven home to me the importance of ventilators in potentially saving lives. GM is saying that it will not be able to fully deliver on the number of ventilators that it has been called upon to make until the end of August, long after states like New York and Michigan and New Jersey will have reached their peaks. This is why it is tragic that the president did not act earlier on the many warnings that he received.
The testing capabilities that we've brought online, and we started really from ground zero. We started from really being very, very outdated and obsolete as a country from the past. And I will say this, if they didn't understand it, it's just really, unfortunately, I hate to say this because we've been getting along very well, but it would be false reporting because they understand the capability. And it's going to be up to the states to use that capability. The states have local points where they can go. A governor can call the mayors, and the mayors can call representatives, and everybody. Everything is perfect. And that's the way it should work and always should work. We'll help New York and all of the other states get even better on their testing. We have to get even better. And some people think a little bit differently. There are areas where You have vast amounts of area where you have very few people and almost no people are infected, and those places will be looked upon differently by different governors.
Well, the reason that there have been lower numbers in a lot of places has something to do with the fact that there is a small amount of testing. And in many of these rural areas where supposedly there aren't a lot of tests and there aren't a lot of cases and there have not been stay-in-place orders, there actually has been, during this week, a dramatic upsurge in cases. We've seen a 53% increase in Oklahoma, a 60% increase in Arkansas, a 74% increase in Nebraska, an 82% increase in Iowa, and a 205% increase in South Dakota.
When requests were made far beyond what was objectively needed, we were hearing from a certain state, and we were hearing from a lot that they needed far more ventilators. In one case, they wanted 40,000 ventilators, 40,000. It turned out that they had plenty, and they had a number of about 7,000 or 8,000, and that was plenty. We supplied them with a lot, but that was the right number. We got it just about right. And if they did need more, we're ready to give more, but I think...
Well, we're not ready to give more because the U.S. does not even have that many ventilators in store. As I mentioned earlier, in 2017, the Pentagon warned this administration that there could be a shortage of ventilators. The president did not take action then. The president did not take action in January when the first cases appeared in the U.S. The president did not take action in February when cases were soaring. Only in near the end of March did President Trump call upon companies like GM to begin manufacturing ventilators, and the first GM-made ventilators were only delivered to hospitals on Thursday night.
Final hospital, and they actually didn't need it. We built a lot of beds, so I appreciate it from the governor. And we saved building a hospital. In New York, we did, I think, just a spectacular job at the Javits Center. And even sending the ship up we brought it into COVID, but they didn't really need it.
The president keeps saying that New York didn't need the things that it got. There are 800 patients in the Javits Center right now. They need it. At least two patients died in the Javits Center this week. At least two more died on the Comfort. They needed that care. President Trump has repeatedly used the word ridiculous to describe what New York asked for. Again, New York currently has over 220,000 cases. So it is not ridiculous that New York requested a larger amount of supplies than other states.
It's ready to go. Still there should something happen, but I think they have it under very good control. As you'll hear from our experts today, we've already built sufficient testing capacity nationwide for states to begin their reopenings. And I think
this is simply not true. There is no nationwide testing system in place, and multiple governors, both Democrat and Republican, are saying that they do not have what they need. Republican Governor of Maryland, Larry Hogan, said that he is, quote, flying blind because of the lack of testing supplies that they have.
Number of deaths at 2.2 million people, and it could have very well been that. It could have been more. Frankly, I've been looking at numbers where it could have been higher than that. 2.2 million people dying. If you figure we lost 500,000, maybe 600,000 in the Civil War, 2.2 million people. A minimum, if we did nothing, would have been 1.6. If you cut that in half, you're talking about 800,000, 900,000, a million people dying. But we did a lot of...
The president is using a straw man argument to say that because he did something, we're better off than if he did nothing. But as new data has shown this week, there are models which show that the president could have prevented potentially as many as 90% of the deaths that have occurred by enacting social distancing guidelines merely a few weeks earlier. And there were warnings in place to have enacted them weeks earlier.
There's a horrible thing that happened to 184 countries all over the world. Is a horrible thing, and there was no reason for it.
It is at least 185 countries, not 184.
In a few minutes, you'll be hearing from Dr. Redfield, Dr. Fauci, Dr. Birx, and Admiral Guar to explain these facts in really great detail. Earlier this week, the FDA authorized 2 new antibody tests, which is very exciting, that will determine if someone has been previously infected with the virus, bringing the total to 4 authorized antibody tests already. This will help us assess the number of cases that have been asymptomatic or mildly symptomatic and support our efforts to get Americans back to work by showing us who might have developed the wonderful, beautiful immunity. Ultimate victory in this war will be made possible by America's scientific brilliance. There is nothing like us. There is nobody like us, not even close. I wish I could tell you stories what other countries, even powerful countries, say to me, the leaders.
There is no one close to the United States when it comes to the number of cases of coronavirus. We have the most in the world. We not only have the most in the world, we have more than the next 4 countries combined. The U.S. accounts for about 30% of the world's cases and about 20% of the world's deaths. So this is certainly an area where President Trump seems to have delivered on his promise of America first.
Time highs. And then one day they said, you got to close it up. And we did the right thing. We saved maybe millions of lives by doing it the way we did it. But we're paying a price, but that price is very unimportant compared to the number of lives we're talking about. The NIH and others are conducting clinical trials of 35 different therapies and treatments. Therapies being so exciting to me because that's really like if something happens, you're going to get better reasonably quickly and without such a horrible deal as some people have to go through. To that end, today NIH announced that it is launching a public-private partnership with more than a dozen.
Now, the president is hyping up these tests, but the World Health Organization issued a warning today about coronavirus testing, saying that there's no evidence that serological tests can show whether a person has immunity or is no longer at risk of becoming reinfected.
Sources, knowledge, assets, and authorities of more than a dozen organizations and agencies to accelerate development of the most promising therapies and vaccines. The vaccines are coming along really, really well. John.
The best estimates are that a vaccine is at best a year away.
Great success, but we have to test them, and it takes a long period of time. It takes probably over a year, unfortunately, but therapies likewise are coming along very, very well. Therapies are immediate when we get that. That'll be a big day. We're also equipping our medical warriors on the front lines. In total, we have the Project Air Bridge, and the air bridge has been incredible. The National Strategic Stockpile and every other channel the federal government has deployed. If you think about this, 44.5 million N95 masks, nearly 524 million gloves, 63.5 million surgical masks, and more than 10 million gowns. And we have 500 million masks coming in very soon between manufacturing and orders. 500 million masks. The last few months have been among the most challenging times in the history of our nation. This invisible enemy is tough, and it's smart, and it's vicious.
Viruses are not smart. They're just things.
Before I talk about the light at the end of the tunnel, we are getting very, very close to seeing that light shine very brightly at the end of that tunnel. And it
is not accurate to say that we are seeing the light at the end of the tunnel. We've added 40,000 new cases in just the last 24 hours. There has been encouraging information that we may be slowing the number of new cases, but we are far from being on the other side of this.
Right back. Thank you. Thank you very much.
All right, so the president seems to be stepping out for a moment, but he says that he will be back. The vice president is going to continue the briefing for now. This is Vice President Pence, the man who once argued that cigarettes do not cause cancer and whose public health policies as governor of Indiana contributed to the state's worst HIV outbreak.
The strong partnership the federal government has forged with states across the country, we're making progress, America. Despite the tragic loss of more than 36,000 Americans. According to our best data reporting this morning, we continue to see new cases low and steady on the West Coast, and we continue to see cases and hospitalizations declining in the greater New York City area, in New Orleans and Detroit, and elsewhere.
It is not true to say that the number of cases is declining. The rate of new hospitalizations is declining in New York, but the number of cases continues to go up.
American people who have put into practice the social distancing, the guidelines, the guidance of state and local officials. And we hope that every American is encouraged by the steady progress that we are making. We're continuing to bring, at the President's direction, the full resources of the federal government to bear. Today, the President approved a major disaster declaration for America and Samoa, and now all 50 states and all territories are under major disaster declarations for the first time in American history. At this present moment, 33,000 National Guardsmen are on duty. 5,500 active duty military personnel have been deployed to 9 states, including 716 medical professionals, doctors, and nurses who deployed out to 14 different hospitals today. Among those were 10 hospitals in New York City, and military personnel were also serving today in hospitals in Connecticut, Texas, Louisiana, and New Jersey. Yesterday, as the President reflected, we unveiled the President's guidelines for opening up America again. There were 2 parts at the beginning of those guidelines. First, the criteria that we hope will guide governors in their decisions about reopening.
But the criteria depend upon governors being able to adequately test to know if there are more cases in the state. And again, this is the sticking point. We do not have the tests.
A reopening plan. For phase 1, the President's guidelines, you'll recall, advise that states that have a downward trajectory in cases over a 14-day period of time and ensure that they have proper capacity in their healthcare facilities could move to phase 1.
Again, you can't know this unless you are able to perform widespread testing.
And in place. But for states that meet the criteria, we outlined specific responsibilities, protecting workers in critical industries, particularly protecting the most vulnerable, those who live and work in senior care facilities. And we also encourage states to have a plan for testing symptomatic individuals and ensuring testing to our most vulnerable populations. As the President has made clear, governors will decide the time and manner that their states reopen, and we will look to support them in that effort. But as we assured the American people yesterday.
Now, he's saying it's up to governors, but the President used some very chilling measures to put pressure on governors today, tweeting in all caps, "Liberate Michigan, liberate Minnesota, liberate Virginia." In the Virginia one, he even included a reference to the Second Amendment, which many people have seen as an actual implicit call to arms for armed rebellion. So that is definitely not consistent with the idea of leaving it up to governors to decide how they would reopen their states.
As of April 16th, as the President reflected briefly, FEMA has coordinated the delivery of millions of pieces of medical equipment, including 44 million N95 respirators, 63 million surgical masks, more than 10,000 ventilators, and of course deployed more than 8,600 federal medical station beds. On the subject of testing.
Now, with those delivered supplies, the New York Times reported that thousands of the ventilators that were delivered arrived broken. Nearly 6,000 medical masks sent to Alabama had dry rot and a 2010 expiration date. So it is, that is some useful context there.
Testing in this country that takes place at CDC or at state labs was designed for basically the kind of diagnostic testing that is routinely required. But the President early on in this effort brought together the leading commercial labs in America. We forged a public and private partnership. And 6 weeks ago, we had performed some 25,000 tests, and at this day, we have performed 3.7 million tests. We believe that labs and hospitals...
The number of tests that the U.S. is performing actually seems to be slowing. Vox reported that it peaked on April 4th and has plateaued or diminished since.
Capacity across the country. We believe that states could actually more than double the amount of daily testing that is happening today by simply activating all of the labs. And Dr. Birx will detail some of those resources today, and we'll be going over those very specifically with governors on Monday. We've also been promoting the development of new and innovative tests. We all know about the 15-minute Abbott test, but the FDA is currently working on an antibody test that literally could add 20 million new tests to our supply even before the end of April. I want to assure the American people that we're going to continue to work with your governors and with your state health officials to scale testing in the days ahead. But as you'll hear from all of our experts tonight, our best scientists and health experts assess that states today have enough tests to implement the criteria of phase 1 if they choose to do so. Let me say that again. Given the guidance in the President's new guidelines for opening up America again, states that meet the criteria for going into phase 1 and then are preparing the testing that is contemplated by going to phase 1, our best scientists and health experts assess that today we have a sufficient amount of testing.
This is not what the people actually in the states say. Just this week, New Jersey's Governor Phil Murphy said no state has the resources they need to test at the scale they need to test.
Our approach will continue to be locally executed, state managed, and federally supported. Dr. Fauci will give us a brief introduction to the overall approach to testing that is contemplated to deal with the coronavirus. Dr. Redfield of the CDC will describe our plan to mobilize CDC officials in all 50 states to specifically monitor coronavirus incidents that occur in every state in the union. Of course, Dr. Deborah Birx will describe not only our tests, but also the current capability and the capability that we could expand to very readily. And Admiral Giroir of the U.S. Public Health Service will summarize our approach. But I want to assure the American people that at the President's direction, we are going to continue to work every single day to make sure that our states and communities have the testing they need to reopen at the time and manner of their choosing. And we're going to work every day to make sure our states have the resources and the supplies to reopen their states and reopen America.
Well, the actual governors of the states have said the opposite, that they do not have the supplies. Only about 1% of the U.S. population has been tested. Now, he's saying that they're laying out now the plan for how Americans will be tested. South Korea developed a plan for testing widespread throughout the country within 2 weeks of the first case in their country. It has taken 12 weeks for the U.S. to put forward that kind of a plan, if this, in fact, is that kind of plan.
And one of them was the question that was just posed a moment ago, is are there enough tests to allow us to be able to go through this first phase in a way that is protective of the health and the safety of the American people? So I just want to spend a couple of minutes clarifying a few things and maybe providing some information on a broad 40,000 foot, which you'll hear some of the more granular details from my colleagues who will be following me. I think they they asked me to give the 40,000-foot one because I'm not a testing person. I didn't run a testing lab, but I'm part of a team that is looking at this, of how we can best make sure this happens in the right way. So first of all, let me say something that we said before, and I apologize if I'm repeating things that you already know, but I think in some respects it's important to do that so that people have clarity in what we're talking about. There are two general types of tests, even though within each general type there are different subgroups. One of them is to actually test for the infection. Is a person infected? The other, and I'll get back to that in a second, the other is to test, as was just mentioned, if someone has been infected. Usually someone has been infected who has recovered, and as I'll get to in a moment, that you could assume, although we need to do some more work on that, that that person is actually protected against subsequent exposure and infection with an identical organism. So what are some of the pluses and minuses of each? Because the pluses and minuses are really going to impact how we best use the test and how the test actually should be used. So let's take the test for whether or not you're infected. The test of whether or not you're infected is a test that right now is called a nucleic acid test. It's not an easy test to do. There are some that are more rapid. There are some that have a high throughput. There are different groups within that. The good news about that is that it's a sensitive and specific test, so that if you're infected, you know you're infected, so that, as I'll get to in a moment, if you need to do something with that, get that person, put them in care, take care of them, get them out of circulation. That's important. The part about that that I think is often misunderstood is that if you get a test today, like I did today, it's negative. If you get a test today, that does not mean that tomorrow or the next day or the next day or the next day, as you get exposed perhaps from someone who may not even know they're infected, that means that I'm negative, which means if you take that to its extreme, in order to be really sure, you would almost have to test somebody either every day or every other day or every week or what it is to be absolutely certain. That's an issue. Now, the problem that I talk about when I try and compare this to other situations with what testing means to you. I, as I think most people know, have been involved in HIV/AIDS for 38 years, 39 years, from the very first week of HIV. So that's what I do. If you get a test for HIV and you are negative and you do not practice any risk behaviors, you can be guaranteed that next month, 6 months, 1 year from now, you will be negative if you don't have a risk behavior. So there's a big difference there about what testing actually means. So the point I think you're getting is that although there is clearly a place for needing to test somebody for a given reason, a test means you're negative now. Now, the other test is an antibody test, a test that tells you, in fact, that you've been infected. That's really good. You're going to hear a bit about that from my colleagues in a moment, because that will give you a broader view of two things. One, what the penetrance of the infection had been. And number two, you can make an assumption, though we still need to prove that. I mean, we are assuming that if you're infected and you have antibody, you're protected. And I think that's a reasonable assumption based on our experience with other viruses. But what we want to make sure that we know, and these are some of the challenges, what is the titer that is protective? How long is the protection? Is it 1 month? Is it 3 months? Is it 6 months? It's a year. So we need to be humble and modest that we don't know everything about it, but it really is an important test. The other thing is the difference between testing and monitoring out there, what's out there. The difference between what we really need it for phase 1 is to be able to identify, isolate, contact trace, a very important part of when you're pulling back gradually and slowly on the mitigation, and you have people who might be infected. You want to know they're infected. You want to put them in care. That is something that we absolutely need to do.
But there are other ways. I want to make sure people understand that not to underestimate the importance of testing. Testing is a part, an important part, of a multifaceted way that we are going to control and ultimately end this outbreak. So please don't anyone interpret it that I'm downplaying testing. But the emphasis that we've been hearing is essentially testing is everything, and it isn't. It's the kinds of things that we've been doing, the mitigation strategies that are an important part of that. Now, just a couple of things before I hand it over to my colleagues. No doubt that early on we had a problem. I have publicly said that we had a problem early on. There was a problem that had to be corrected, and it was corrected. It was a problem that was a technical problem from within that was corrected, and it was an issue of embracing the way we have now and should have the private sector, who clearly has the capability of making and providing tests at
what Dr. Fauci is referring to is twofold. First of all, in January, before they'd had a single case, Germany began developing tests, and the CDC in February was providing 250,000 of these tests to countries around the world. The U.S. refused them, saying we'd make our own. But the first batch of tests that the CDC made, first of all, it was only 90 tests to begin with, and there was something wrong with them. They didn't work.
my colleagues, because believe it or not, some long time ago, I was where they are, in the hospitals, in the emergency room, looking at very sick individuals that you need to take care of. And I know what it means when someone tells you, hey, you have what you need, and you look around and you say, well, maybe you think I have what I need, but I don't really have what I need. So we have to figure out, how do we close that gap? And there are a lot of things that I think we've learned and that we are correcting and going to correct. Namely, you have a situation where tests are needed and appropriate, and either people have found there's no tests, or there's no reagents, or there's no swabs, or a person needed a test and were told that there was a restriction. They couldn't get a test. These are all the things that I'm telling you, you already know because you've heard them. So right now, or there's a delay of 5 to 7 days. And what does that mean if you want to get somebody out of circulation? We understand that that existed, but upon careful examination, what you are going to hear, that many of those have been already corrected and other of those will be corrected. Because what I think people don't appreciate through no fault of their own is that there are two issues. There's supply and demand. And if you have a supply that can meet the demand, but the supply is not connected to demand, then supply-demand falls apart. What do I mean by that?
Well, Dr. Fauci is highlighting part of why it does not make sense for President Trump to say that states are on their own to get these tests. This needs to be coordinated at a federal level. And as Governor Cuomo highlighted in his press conference today, he can't work out international supply chains the way the U.S. federal government can.
That's what we're talking about, because for what we need now, we believe that with better communications, we'll be able to make that happen. So I know there's going to be a lot of questions about that. I don't want to go on too long, but let me just finish by saying, given what I've just said and what I believe what you're going to hear, that for what we need in the first phase, if these things are done correctly, what I believe they can, we will have and there will be enough tests to allow us to take this country safely through phase one. Thank you.
Thank you, Dr. Redfield.
Thank you, Mr. Vice President. I want to make a few comments here.
This is Dr. Redfield, the head of the CDC, the man who was responsible for a Reagan-era military policy regarding HIV and AIDS, which has largely been seen as destructive and discriminatory. He advised against the use of condoms and was affiliated with a group that declared that AIDS was God's wrath. This is Trump's head of the CDC.
This current pandemic, the reality is we know a lot because we've developed these monitoring systems. Up on the slide is a system that we've developed initially for flu, and what it does, as you can see, there's a multiple different flu seasons, and they track them over the course of a year. I want you to look at the red line, and that happens to be this year's respiratory season. And you see there's a peak there up over the 50-52 week, and that peak was when we actually had a peak of influenza B. This year was a little different because after that, viral syndrome came down, and you can see it that actually we had another peak, and that's when influenza A was active through our country. And you can see influenza A started to drop, but then you saw a third peak. That peak was, you were looking at the coronavirus 19. So we have systems all the way down to the county level that we can see where there's respiratory tract illness. And so it's not just taking a test, it's monitoring these systems that have been developed over decades. And we have multiple ones. We have another one that is monitored in emergency rooms, looking at syndrome diagnosis. And they show the same thing. So we're well equipped to monitor to see when respiratory tract viral disease will come, and becomes a very good surrogate for when you can begin to understand that we need to start looking more etiologically about what's going on. You can see now in week 15, we're really coming down to the baseline background in terms of our flu surveillance system from the overall coronavirus situation right now. The second thing I wanted to say is that CDC continues to enhance the state's public health capacity to accelerate their ability, as Tony talked about. It's critical as we open America again, to diagnose individuals that present with influenza-like illness or coronavirus-like illness, to diagnose them, to be able to isolate them, and to be able to contact trace around them, and then diagnose the contacts and those that are coronavirus positive to go back and do their contacts. This is the traditional public health approach, which was started in this outbreak in January and February and was quite successful when, as I mentioned before, through February 27th, this country only had 14 cases. We did that isolation and that contact tracing, and it was very successful. But then when the virus more exploded, got beyond the public health capacity. But right now, CDC is enhancing that public health capacity. And if I can get the second slide, I want to show you that this is just showing, as we sit here today, that CDC has embedded in these health departments in all of these states across this country more than 500 individuals. We also have an additional almost 100 individuals that are working on more than 20 coronavirus outbreaks that are going through all these states. And finally, at the direction of the President, we've been asked to further enhance this deployment in each of the states, as the Vice President said, so that there's additional public health personnel to help accelerate the state's ability to basically move forward aggressively, and we assist them so they can operationalize the President's guidelines to open up America again. So I just wanted to make those points for you today.
Great job. Thank you. Dr. Burks?
Thank you, Mr. Vice President, and thank you, Dr. Fauci and Dr. Redfield, for all of that clarity. If we can have the next slide. I'm going to go back to what Dr. Fauci was talking about, just to emphasize those points about the two types of tests, and I'm going to talk about a third one. So first, we all know about sampling in the front of your nose. To all of the labs out there and to the providers, you don't have to use the nasal pharyngeal swab anymore. You can do front of nose sampling. And again, as Dr. Fauci talked about, that is sampling for the virus itself that replicates in your nose and, as we know, throughout some of the respiratory tissues. The second test is, of course, then your immune response to that infection that's in your nose. And so that's the antibody test. And so those are the two tests we want to talk about. But I want to come back to something that both Dr. Fauci and Dr. Redfield said, and we covered yesterday. Testing is a part of the exquisite monitoring that needs to occur in partnership with CDC and state and local governments, utilizing the surveillance systems that are available, what we just talked about, the flu surveillance system, because we no longer have flu, and the syndromic respiratory system that is across the United States. And you can see it's going back to baseline so that we'll be able to see at the community level any deviation from that baseline. In addition, what we talked about yesterday was adding that asymptomatic component, because I think you'll see as more and more articles come out for surveillance and monitoring that other states have done, higher and higher antibody in multiple individuals who don't remember having a sickness. And that will give us an idea. That's our asymptomatic monitoring in these sentinel monitoring sites. And what did we talk about yesterday? We talked about nursing homes, we talked about indigenous people, and we talked about vulnerable people in the inner city, really ensuring that something that is so small that can't even be seen on the surveillance monitoring will be able to be seen in the asymptomatic. And so those are the two tests that we have, one available now, two that have been approved, or three by the FDA. I want to just leave you with my last concept on the antibody tests. Antibody tests have different specificity and sensitivities. The FDA, their FDA has been very cautious about the antibody tests, because I know you see reports every day of countries that have ordered the antibody test and found that they were 50, 60, 70% faulty. So we're taking that very seriously, because you never want to tell someone that they have an antibody and potential immunity when they don't. And so those tests perform better when there's a high prevalence or high incidence of disease. So we want to work with mayors around the United States as those antibody tests become available to really see what it is in first responders and healthcare workers in the highest prevalence states, so that we can know about the quality and the real life, real field experience of those assays. Because things can look very good in the lab, and then when you take them into the field, sometimes they're not as good. I've learned this lesson repeatedly in working around the globe. The next slide. So this is what we have asked commercial and diagnostic companies to be working on. Because when you talk about multi-millions worth of tests, the way we do this in the United States today for strep, for influenza, and for malaria is we test for the antigen. Now, we don't know right now if you shed antigen in the front of your nose. And so that is the question that scientists and companies are working on right now, because that becomes a simpler test. Now, the flu test, I think many of you will look it up tonight. You will see that outside of the flu season, because of the specificity of the test, it doesn't work so well. So these are tests we're working on today that would be like a screening test, because if you're positive on it, it's a good test. But it may miss that you actually have the flu. So then you would move into what we call the nucleic acid test. So we're trying to build an algorithm of tests that bring the full talent of the science of the United States into the reality of the clinic. And so bench to clinic. And so this is what we're working on for the future. Next slide. So as I promised both the senators and the governors, this is the United States' current platform capacity, designated as high and low throughput. And what do I mean by that? We've talked about the high throughput platforms of Roche and Abbott and others. And then we've talked about the Gene Expert and other machines that may be moderate to lower throughput. I want you to see how it's distributed through the United States. So these are the current testing platforms available today throughout the United States for COVID-19. And as you heard from Dr. Fauci, everything has to be working from the swab to the transport media to the laboratory to really get those tests run and the results back to the client. The next slide. So then we've looked at all of the testing capacity from those platforms, and this gives you an idea of what that capacity is. The darkest red that you can see, like in Texas and New York, those are states that have lots of different platforms, as you saw on the prior slide, and the ability, if you just add up the platforms and the potential for tests, of over 1 million tests per month. And so this is what we're working with each of those states on unlocking that full potential. And how are we doing that? Well, we're calling on the American Society of Microbiologists. They work closely with 300 lab directors around the country. We talked with them this morning. And the Walter Reed team, who developed the entire HIV testing program for the military 35 years ago, have called them back into service, and they're calling lab by lab to find out what are the technical difficulties to bring up all the platforms that exist in your lab. Is it swabs? Is it transport media? Is it extraction? And I just really want to thank them. They've already worked through over 70 plus of those laboratories to really understand, and the American Society of Microbiologists and the academic societies of the laboratories are working together to ensure that all of this potential can be unlocked. Next slide, please. We talked a little bit yesterday about New Orleans, and the president talked about how many tests New Orleans has done during its outbreak, which you can see now is waning. They've done throughout the last month 27 tests per 1,000 New Orleans and Louisianians. So 27 per 1,000. So that is a good mark, and that's what Italy has done, about 20 per 1,000. So in evaluating an outbreak, and really to get control of this outbreak, they did about 27 tests per 1,000. So using that as a measure, next slide, we then looked at across all the states of the United States of America and looked for states that had 30 or more, ability to do 30 or more tests per 1,000 of their inhabitants in each state. And you can see that across the country, except for Oregon and Maine and Montana. I worked overseas way too long. Thank you all. So those are the 3 states that we're working on building capacity in. So this is just to give you a perspective of how seriously we're taking the testing issue. As we've described, we've measured every single platform in every single state. We know exactly where they are by geography, by address, by zip code, what their capacity is, what their cumulative capacity is, what their roadblocks are on not ability to run all their full capacity. And we're addressing those because each one of those is different, and you have to address each of them one by one with the governors, with the state and local labs, and with all of the hospitals. I have not come across one laboratory or one laboratory director or one society that doesn't want to contribute to solving this issue of testing and ensuring that this testing is available for everyone. There is a strong, just as all the Americans have social distanced, in behind everyone, we don't often talk about the laboratories, we'll talk about the nurses and doctors on the front line. Behind all of them are the laboratory technicians and laboratory directors who are coming in every day and putting things together to ensure that every single person that needs to be diagnosed is diagnosed. And hopefully you can see from these these slides, that really there is capacity out there. It is our job working with the states and having the state in the leadership role and the laboratory directors in the leadership role to provide support to ensure that all the potential for testing in the United States is brought to bear. I just want to end with, these are nucleic acid tests. There will never be the ability on a nucleic acid test to do 300 million tests a day or to test everybody before they go to work or to school. But there might be with the antigen test. And so that's why there's a role for nucleic acid tests, there's a role for antibody tests, and there's a role for the future development of these other key tests to bring the full ability to the United States. And so when we finish this, we'll be talking to all Americans because there's other tests that other Americans should have. And I think this has really brought to light the importance of diagnosis. And we'll talk to you further about hepatitis C and TB and other things that we can do to ensure every American is healthy, because I think this has really raised the awareness among all Americans about how you do tests for different kinds and different parts of your disease state, and what is long-lasting immunity and what may be long-lasting immunity, and what is a nucleic acid test and what an antigen test is. And with that, Admiral Gerard.
Great. And let me amplify one.
I just want to follow up on that. So it looks like there's starting to be a plan for nationwide testing. It is April 17th. This starting to make a plan is what South Korea did in January after their first case of coronavirus on January 20th. That was also our first case of coronavirus. It is only now in April that we are starting to put together a nationwide plan. And it is so tragic to note that while based on population, our death toll should be higher than South Korea's. It should be roughly 6 times higher. And instead it is nearly 160 times higher.
I'll allow Admiral Gerard to complete our briefing on testing, and we expect the President to return.
Thank you, Mr. Vice President, and thank you to all my really great colleagues. Can I have my next slide? So I wanted to start by where we are today, and just to visit where we've come in such a short period of time.
I'm going to try to change sources so that you can get a better look at that slide.
0.78 million tests that have been completed. And if you are impressed by bar graphs, that's over 1.2 million tests reported just in the last week. Ambassador Birx talked to me a little earlier, and she said, you know, we only do about 2 million molecular tests a year for HIV, something that's been developed for 35 years. We're now doing twice that number of tests in a month for a disease that has never been known before, that there's never been a test developed before, and that's sort of where we are and where we've ramped up. I also want to give you a little idea. The lighter blue or lighter gray is our ID Now tests. So we talk about them a lot because they are a point-of-care test that can be between 5 and 15 minutes. And they have a very specific role, but they're not for everybody. If you've got to screen a few thousand people, 4 tests an hour doesn't get you there on a machine. You have to use some of the larger, higher throughput items. But they have a very important role. And again, coming into the market at 50,000 per day is really an important adjunct to us. She talked about the Gene Expert from Cepheid. Very important. We don't talk about that very much, but it is one of the backbone mobile point of care, not as easy to do per se as the Abbott, but it is a point of care test that really carries tuberculosis screening all through Africa. There are these machines, you saw that on her slide. Every one of the 50 states has this in over 600 sites, and they've done over 700,000 tests just on that relatively low throughput but very important platform. Next slide, please. I wanted to give you an idea sort of how the tests are distributed and how they're changing over time. On the left are the state public health laboratories, and although their numbers are relatively small, about 350,000, the state public health laboratories are absolutely critical. They're an absolutely critical core component of our testing. Not only were they there early and first, but they also do things like support outbreak investigations in nursing homes or investigations in certain plants that have a close proximity with everyone because of their work environments. They also do testing on many people who do not have the opportunity to be tested elsewhere, and they are performing outstandingly well. ACLA, I know we hate acronyms, but the American Clinical Laboratory Association. This is America's commercial industrial backbone that we're standing behind the President and the Vice President, and when I was there a few weeks ago in the Rose Garden. This is the LabCorp, the Quest, the BioReference Laboratory, Mayo, Sonic, and ARUP. and you'll see they've done almost 2.3 million tests. This is the very large high throughput machines that Dr. Birx talks about. And I want to be clear about this group is that it doesn't matter where you are. I just took one of the largest labs and I said, map out for me where you are within 10 miles of where you are, every site in the country. And when you do that, within 10 miles of a site of one of these, 93% of the U.S. population is covered. These are truly national reference labs that cover almost everybody within the United States. So if you cannot get a test at your hospital, the chances are overwhelming that you could send this to these labs that are fully caught up now. They have no backlog of tests. They've ramped up their production, so their turnaround time is about 48 hours because you may need to transport it from the middle of America out to a lab and result that. But that's really very, very, very good. The American Hospital Association, also academic labs. As the Vice President and the President have said, as more and more labs come online, they're increasing the amount of testing that are done just at the hospitals or at academic medical centers, now almost at 600,000 tests. And again, matching the other slide I had, the Abbott point-of-care test, just to give you a distribution. And that point-of-care test is being used very importantly in very select populations where a point-of-care test is really needed. That could be in some hospitals where someone needs to know exactly if a person is positive or not to go on a clinical trial, or in a nursing home investigation, or sometimes to get people screened to go back into the work environment. Most people don't need a point-of-care test. In fact, a point-of-care test cannot replace the millions of tests that are here on the other side. Next slide. I don't know how interested you are in swabs. I did not know a whole lot of swabs before a few weeks ago. But there's 2 points I want to make with these slides. Is yes, there have been constraining elements. And they're constrained for a couple reasons. Number one, because this is an unprecedented scale up of this type of very sophisticated.
All right, since unfortunately I can't seem to get you a better shot of the slides, I'm just going to give you a little bit more information about Admiral Brett Giroir. As an Assistant Secretary for Health at HHS, Giroir headed efforts to dismantle the Title X Federal Family Planning Program, the only federal program that offered low-income families family planning services. When Giroir was being appointed as acting FDA commissioner in 2019, Senator Elizabeth Warren said, quote, "I have concerns about your appointment because during your time as the Assistant Secretary for Health at the Department of Health and Human Services, you have undermined evidence-based programs and promulgated policies based on political ideology behavior that is antithetical to the very mission of HHS and the agency you are now charged with leading." The National Women's Health Network petitioned against his nomination to HHS in 2017.
In the system, more than enough to obtain the capacity that we need. Next slide. For these molecular tests, you take a swab and you stick it in a test tube. And that test tube has to have a specific kind of liquid in it. And when we started, it was viral transport media, a very special kind of media. The CDC has a make-your-own recipe. If you're interested in cooking, you could probably do that. But it has a lot of ingredients that go in there, but still very limiting. We've worked with many, many different laboratories. We've worked with the FDA. So now PBS, phosphate buffered saline, a kind of just laboratory-grade salt water can be used for this. This greatly opens the ability to expand the test to support all the capability that Dr. Birx talks about. And again, by the end of April, we will have put well over 5 million new tubes of either viral transport media or saline into the system. I am going to get to a conclusion here, but this was going to be more of a technical briefing. Next slide. So let's talk about the fact that the science tells us that we have and will continue to have enough tests to safely go into phase 1. So let me be very granular about this. We've already heard that it is beyond the possibility to test everyone in this country every day. It's not possible. but it's also a bad strategy because testing a person now just means they're negative now.
So again, this is a little bit of a straw man argument saying that, well, because we can't test everyone every day, that it's okay to do much less testing. I want to just put in context that it's only roughly 1% of Americans who have been tested at this point. And even though New York is doing more testing than any other state, New York accounts for roughly 25% of the nation's testing. The testing is so limited that at some hospitals they have barred doctors and nurses from being tested because they're saving those tests for the patients.
There. But let's just take a number that we are going to enter phase one when there are 200,000 new cases per month in the United States. Don't get hung up on that. It's going to be much less than that, but let's just say 200,000 cases. So how many tests do we need? Well, we need to test those 200,000 people to make the diagnosis, right? Everybody nod your head about that. We have to do that. Now, what's a safe number over that? You know, if everybody I test has the disease, I'm not testing enough, right? But if I test 100 people to have one person with the disease, that's probably over-testing. So we kind of assume that a safe number that really gives us a good idea is if about 1 out of 10 people are positive. Then we know we're oversampling the population enough that we're getting all the positives. So if there's 200,000 cases, I need about 2 million tests, okay? Now to go to Dr. Redfield's point. Each one of those that are positive have contacts that need to be traced. And on average, the CDC tells me that for every positive, there are about 5 contacts that really need to be traced. So let's assume that those 200,000 people have 5 contacts. So now we have an extra million tests. So 2 million tests out there to detect the 200,000 cases, an extra million out there to trace those contacts. So we're up to about 3 million cases. If you want to put a fudge factor, say that's 4 million tests, okay? Those are generally done at the main hospital labs, the commercial labs, state and regional labs. All this can be done, as well as some of the labs talked about by Dr. Burks. Next slide. The second group of testing fits exactly perfectly with the influenza-like surveillance system that Dr. Redfield talked about.
So now, again, he said don't be hung up on the specific numbers, but he's talking about 4 million tests being sufficient. That is not enough to, that's just barely enough to test 1% of the U.S. population.
You know, you could have this virus and shed it and not have symptoms or only mild symptoms. So what is the strategy here? The strategy here, this is an unprecedented strategy, okay? This is really unprecedented. But we're going to do between 300,000 and 500,000 tests per week in the most vulnerable populations that we know that the virus could circulate. And what are they? Number one, nursing home and long-term care facilities. We know that from the history of this virus that can circulate and be devastating, and it could circulate even in a way that you don't have symptoms. So we're going to survey in a very controlled way, driven by the CDC, supervised by the CDC, surveys over, we may not get to everyone, but surveying in the areas to cover in a selective way the 15,000 or so nursing homes. Secondly, we want to work in vulnerable members in cities. And this is the way we think about that is community health centers. I'm a huge fan of community health centers that are led by HRSA. There are about 30,000 community health center sites. They take care of 30 million people, children, adults, elderly. They care for about 1/3 of Americans below the poverty level. They are arrayed to take care of our most vulnerable populations. So we want to survey asymptomatic people in those community health centers. We also want to do in some of our indigenous population, and you know very early I was out here bringing machines to the Indian Health Service, and in fact 1,800 members of the Public Health Service provide care to the Indian Health Service, and their director and chief medical officer are both admirals in the Indian Health Service. Plus workplace monitoring, particularly for workplace environments that may have very close contact or may have a high risk, and some of those could be agricultural facilities. So let's just total that up. We have 200,000 people who need a diagnosis. To make that diagnosis, we want to test 2 million. Okay, so that's 2 million. We're going to contact trace with 1 million. And let's just throw you a fudge factor of about 25% on that, so that's 4 million. And we have this background testing of about 400,000 per month. So to safely do the testing, we need to be in the range of 4.5 million. You followed my numbers, because I want you to understand, per month. That, pardon me? For phase one. For phase one, right, for phase one. And I want to tell you that's really how it adds up, and that's where we are. Right now we're doing about 1 million to 1.2 million per week. We are going to continue to push that farther and further as we open up the laboratories and we're able to open all the supplies that we need for that. And I think that's where I would like to end. Thank you.
Thank you. I'll ask the team to step back up for questions, and we do anticipate, as the schedule permitted, that the President will be returning momentarily. Please.
You talk about phase one. Will there be enough testing for phase two? Do you have to ramp up capacity for that, or how do you deal with that?
That's a very good question.
Yeah, that's a great question. And what we will be doing is monitoring how much we have to use in phase one to really help inform phase two. Because the really unknown in this, to be completely transparent, is asymptomatic and asymptomatic spread. And so if we find that there's a lot of asymptomatic individuals that we find in this active monitoring in what we are very much concerned about, the most vulnerable, then we will have to have increased testing to cover all of those sites.
And as we've made clear to the governors and other health officials, we're going to continue to scale the testing. As the President's made clear, we want governors and states to manage the testing operations in their states. We've given criteria, we've given guidance for how we think that would best operate. But we're looking for the states, we're looking for the governors to manage it. But in the midst of that, all these great experts working with all these great facilities are going to continue to use that great American ingenuity to scale and increase the availability of testing for states to be able to implement as they move closer and closer to that day the President speaks of often, where we reopen America and put all of America back to work. Mr. President?
You did well. They all did well, I think.
So I think we heard a suggestion that at some point we might be testing 4.5 million a month. That's hard to believe, given that we've only conducted under 3.5 million tests since February.
We're fomenting rebellion. Wondering how that squares with the sober and methodical guidance that you issued yesterday.
Well, I think we do have a sobering guidance, but I think some things are too tough. And if you look at some of the states you just mentioned, it's too tough, not only relative to this, but what they've done in Virginia with respect to the Second Amendment is just a horrible thing. They did a horrible thing, the governor. And he's a governor under a cloud to start off with. So when you see what he said about the Second Amendment, when you see what other states have done, no, I think I feel very comfortable. Go ahead.
Thank you, Mr. President. Just to be clear, when you talk about...
Now, on the Second Amendment, so President Trump, of course, is very adamantly pro-gun, and he and Republicans have been working to make sure that gun shops are considered essential businesses. There are more curbside gun dealing opportunities in the U.S. now than there are drive-through testing locations.
Out in protest are going to spread COVID to other people. They're congregating in ways that health experts have said they should not.
No, these are people expressing their views. I see where they are, and I see the way they're working. They seem to be very responsible people to me.
These responsible people that the president is talking about this week in Michigan blocked the entrance to a hospital so that an ambulance was not able to get in. We have covered their protests. They are not social distancing. They are not wearing masks.
It's like Florida or more rural parts of the country where they aren't projected to peak for weeks or even months. So can you talk a little bit about some of the difficulties that those later peaking states might face if they need to stay locked down for longer, even as other places around them are starting to open back up?
Well, we're seeing great numbers in almost every state. We're seeing big drops. We're really seeing, in terms of beds, the numbers we have to look at are the beds being occupied, people going, which is essentially people going in. That means that you have fewer people that are sick, fewer people that feel they have to go to a hospital, and those numbers are dropping really precipitously. So I think that we're just seeing a lot of good signs. Now,
the numbers are not dropping precipitously. While there are indeed encouraging signs, I want to highlight again that there were roughly 40,000 new cases in the U.S. since yesterday.
It's starting to do well. So I just think Illinois is another one. You know, you look at some of the numbers, but everyone is dropping, and they're dropping rather quickly. We don't have any hotspot that's developed where all of a sudden you...
This is not true that everyone is dropping and dropping rapidly. And in fact, as we highlighted earlier, many of the states that do not have strong stay-at-home orders in place have seen dramatic increases in the past week, including South Dakota having an increase of over 200%.
Been really improving greatly. Please, in the back.
Thank you, Mr. President. U.S. intelligence is saying this week that the coronavirus likely came from a level 4 lab in Wuhan. There's also another report that the NIH, under the Obama administration in 2015, gave that lab $3.7 million in a grant. Why would the U.S. give a grant like that to China?
The Obama administration gave them a grant of $3.7 million. I've been hearing about that. And we've instructed that if any grants are going to that area, we're looking at it literally about an hour ago, and also early in the morning. We will end that grant very quickly. But it was granted quite a while ago. They were granted a substantial amount of money. We're going to look at it and take a look, but I understand it was a number of years ago, right?
So you are...
When did you hear was the grant was made?
2015.
2015. Who was president then? I wonder. Okay. Yes, ma'am.
And Mr. President, we know negotiations are underway for the next round of funding for small businesses.
Yeah.
If tens of billions of dollars went in a matter of days the first time, will this next relief package be enough?
Well, I think it will certainly, it's going to get us to a point that's going to be rather beautiful. We think that that will be the point, and it could be they'd want more, but maybe at a certain point we're going to stop. It's been a tremendous success. It's been executed flawlessly. SBA's done a very good job, but the banks have done a great job.
It is not true to say that it has been executed flawlessly. The president's talking about the Paycheck Protection Program. Many small businesses say that the program is deeply flawed. And CBS reports that numerous small business owners complain that the design and lending initiative is overly restrictive, hampering employers that need a measure of flexibility in deciding how and when loans are used. The long and the short of it is, while they have processed a lot of loan applications, they have not been able to process a large number of them because they're simply overwhelmed, and many of these banks are refusing to do business with new customers so that small business owners who don't have an existing relationship with that bank are effectively barred from the program.
That you read about every day, it's all of these small businesses when added. It's something that should be approved by the Democrats. The Republicans want it badly, and the people want it very badly.
Follow up on that. Nearly 10% of the loans that were given out were for $5 million, but some small business owners say they can't even get a loan for $100,000. Is that acceptable?
Well, they would get that, but they have to approve it. Nobody knew it was going to be this successful. Don't forget, when you say the money's gone, it's been a tremendous success as a program. People they really want it, and some people won't be able to get there.
Also, calling the high demand for it a success is an odd thing. He's not selling hotcakes. This is money that's available for companies that are in distress. Highlighting the high demand is highlighting the great distress that the businesses in our country are in.
She's not doing her job, and there's nothing unusual about that for her.
And Leader McCarthy said they're now considering also adding more funding for hospitals included
So they are thinking about hospitals, and hospitals, well, hospitals are a good thing. Hospitals have been decimated by this. You know, they've given up their business, which is good because they did the right thing in order to take care of the COVID-19. And no, hospitals, I'm with that all the way. They want to add hospitals. We could also add it into phase 4 if we do a phase 4. Phase 4 would be hopefully infrastructure. A lot of...
So what the president is alluding to here is the fact that he had requested an additional $250 billion for this small business loan program. Democrats support that, but they insisted that it be paired with additional funding for hospitals and state and local governments, and funds aimed specifically at minority-owned and rural small businesses. McConnell and Republicans opposed those additions and opted instead to just let the funding run out. And President Trump now is saying he does want money for hospitals, but they'll have to wait. They have to get in line behind businesses.
But I think that's something that could be done. It's simple. It's really good for both the company that employs these people and for the people that are employed. So we're going to see whether that happens or not. The payroll, I put it out there, the payroll tax cut would be a tremendous incentive for this country. Steve?
China now says its coronavirus death toll in Wuhan is 50% higher, up to about 4,000. Does that sound like a credible number to you?
Well, you know, when I listen to the press every night saying we have the most, we don't have the most in the world deaths. The most.
We do. We do have the most in the world deaths. If that is not up for debate, the U.S. accounts for 20% of the world's deaths.
A tremendous problem, and they must have the most. So today I saw they announced that essentially they're doubling up on the numbers, and that's only in Wuhan. They're not talking about outside of Wuhan. So it is what it is, Steve. It is what it is. What a sad state of affairs.
Investigation into whether the virus escaped from this lab in Wuhan. How active is that? And when do you expect
we're looking at it. A lot of people are looking at it. It seems to make sense. They talk about a certain kind of bat, but that bat wasn't in that area. If you can believe this, that's what they're down to now is bats. But that bat is not in that area. That bat wasn't sold at that wet zone. It wasn't sold there. That bat is 40 miles away. So a lot of strange things are happening, but there is a lot of investigation going on, and we're going to find out. All I can say is wherever it came from China, in whatever form, 184 countries now are suffering.
It's 185.
And it's too bad, isn't it? And it could have been solved very easily. When it was just starting, it could have been solved really very easily.
Well, it could have been confronted more earlier in the U.S. We know that this administration was warned in November of 2019. Again, it is April, and we are only now coming up with a plan for widespread testing.
And the snafus are very minor.
You're not talking about massive numbers of dead people who've received?
No, they were 80 million payments went out over a period of a few days. And they caught certain mistakes that they made, but this is a tiny amount of mistakes. I can tell you mistakes that were made in government where wrong countries were signed, okay? 80 million, this has been a tremendous success. And any mistake that was made, they've been caught. And it's less than 1%. That's a very good percentage, I can tell you, for government. I mean, how about the Obama website, the Obamacare website, where they spent $5 billion on building a website that you could have built for peanuts? Okay.
If money went out to deceased people, is the government going to get that back?
Yeah, anything that was sent out, it's like sometimes you send a check to somebody wrong. Sometimes people are listed, they die, and they get a check. That can happen. You're talking about, I guess the number is about 80 million people. Yeah, sure, we'll get that back. Everything we're going to get back. But it's a tiny amount. They've done a fantastic job. This was done in a matter of a few days. Yeah.
Your campaign said today that they are planning on resuming rallies before the election. Is there a timeline that you're looking at? Would it be restricted to certain states? Have you thought about how that would work?
Well, I hope we can do rallies. It's great for the country. It's great spirit. It's great for a lot of things. To me, it's a tremendous way of getting the word out. If you look at our success rate, we've had tremendous success. We win where we have rallies, including endorsements of candidates. Our success rate is, I think, unparalleled. There's nothing like it. So I certainly hope we can have rallies. We'll find out. I don't like the rallies where we're sitting like you're sitting. I mean, you got many reporters outside trying to get into this room, and I come in, I'm looking at this room, and I see all this. It loses a lot of flavor. It loses, to me, a lot of flavor. But I hope we're going to have rallies. I think they're going to be bigger than ever. I will say this, the rallies...
So the president is talking about how good his rallies are for the nation. I want to highlight that the counties in which he has held rallies have seen an uptick in hate crimes. There have been other negative impacts on those communities from his rallies, and we're going to pull up some information on that. I also do want to highlight that it is fairly clear that the president is often using these briefings to serve the purpose of a rally.
Mr. President, under your reopening plan, some workers can go back to work in phase 1, but schools cannot reopen until phase 2. Many parents don't have an option to work from home. So how can you get businesses back up and running as long as schools are closed?
Well, I think the businesses are going to, and I think now we've given the businesses a real jolt, a real positive jolt. They're able to keep their employees. You know, without the employees, if the employees leave that area, if they leave, you know, who...
The president's dodging the actual question here. So the question is that he has set up a series of phases in which people return to work. Businesses open in phase 1, but students don't return to school in phase 2, as the reporter highlighted, since access to affordable child care is very limited in this country. How do you return to work if you don't have a school to keep your kid safe in? And the president is sidestepping that issue.
A virus, the likes of which this world has not seen since 1917, which was the Spanish flu, where anywhere from 75 to 100 million people were killed.
The number that the CDC gives is about 50 million. By the way, I want to note, again, on the rallies are good for the nation, Forbes reports that 14 cities across the country are asking the Trump campaign to pay a combined $1.82 million for public safety costs that the cities have had to bear for the MAGA rallies.
A closed economy. We had the best economy anywhere in the world by far. We had the best economy we've ever had.
It is not true that we have the best economy that we've ever had. There are many metrics that just don't have time to get into, but in many measurable ways, the economy was stronger under the previous administration, and real wages had been declining for workers.
Once, and you know, we're paying almost zero in interest, like in some cases zero. We've never had that before. People want the safety of our country. But if you would have told me that a market was where it is today, and today we had almost, I guess, more than a 700-point increase, and we're at a point which is, you know, it's not what it was.
The president is highlighting a rebound in the market that has happened. That doesn't correct the fact that the market has closed its worst quarter in 124 years. So the fact that some of the losses have come back does not mitigate the fact that the economy is in a terrible situation right now.
Isn't infected, and you have people coming perhaps outside. That's one of the reasons I was asking Tony 2 days ago about masks. Well, why in Wyoming or Montana would they have to wear masks? Their numbers are very good. And the reason, if somebody comes from outside, you know, which is very severe, but it's, again, and it's going to be up to them. It's a recommendation, but we'll see. But if you would have told me how well we're doing after we went through the worst event of its kind since 1917, it's pretty amazing. Question,
Mr.
please.
President, about child care, though, millions of Americans aren't sure how they can go back to work if schools are closed. How can they have their kids taken care of? Is your government considering something in addition to helping employees stay employed to help them take care of their kids?
It's a good question. I think the schools are going to be open soon. I think a lot of governors are already talking about schools being opened. And we do have to take care of our seniors because we've learned a lot about this disease. We've learned, call it a disease. We've learned a lot about this plague. and we have to take care of our seniors. We're going to take care of a lot of people. But I think the schools are going to be open sooner rather than later. And I understand, and I've spoken, some governors are already thinking about getting the schools open. I have a young boy who goes to school. I'd like to see him go to school. As good as home is, it's very nice, but we'd like to see him go to school, please.
Thank you, Mr. President.
The president seems to be backtracking away from his own plan because his own plan had businesses open before schools.
They don't have a decline in cases yet you tweeted out today that you'd like to liberate them.
Well, they're going to have soon, but they're very, what they've done is very powerful in terms of, I think, you could get the same result out of doing a little bit less. What they've done to some people is very unfair. In Virginia, I'm going above and beyond what we're talking about with this horrible plague. They want to take their guns away. Okay? They want to take their guns away. That's the Second Amendment. That's Virginia. You have a governor who really, I guess he should be under siege. He seems not to be. If he were a Republican, he'd be under siege. But he seems to have escaped something that was pretty bad, including what he said about birth, including what he said about many different things. But he wants to take, if you take a look at what's going on in Virginia, they want to take away Second Amendment rights, and that's what they want to do.
This is just not true. This is a talking point that gun enthusiasts use all the time, which is to suggest that any restriction, any common sense gun reform is equivalent to utterly removing the Second Amendment and taking away the guns. And it simply is not true.
Something bad that we think is wrong, we're going to come down very strong on that, very, very strong. The federal government has a lot to say. We have a lot to say beyond what anyone understands. And we think, and I've gotten to know many of the governors, many Democrats too. It's Republicans, and I knew the Republicans. I knew some of the Democrats, but I got to know a lot of them. I think it's going to be in the hands of a lot of good people. I think a lot of good people are looking at this, and they want to do what's right, Steve.
The Vice President is traveling soon, and I think tomorrow to Colorado. When are you going to be in a position to travel again?
Well, they'd rather not have me travel. I think I've been in the White House, I don't know, for months. I don't know what it is, but it's for months. Other than I did leave to say goodbye to our beautiful ship, right? The Comfort, as it left Virginia, where it got out of dry dock. It got out of maintenance very early. It was supposed to be there for 4 weeks. It was there for a few days. Literally, we got it up to New York. I mean, they didn't need it like. Well, I wouldn't say we hoped. I'm glad they didn't need it. They didn't need it. That was a good thing. They didn't need the convention center, 2,500 beds, or depending on your definition.
This is frankly an insulting thing that the president keeps saying, that New York did not need the Javits Center or the USNS Comfort. There are patients in both facilities that need to be there. There are 800 patients in the Javits Center. Yes, that is fewer than had been anticipated based on the numbers that New York was working off of that it had received from the White House, but those facilities are needed.
New York's making progress.
Is it important to you that Vice President is going tomorrow?
He's going to Colorado? I think he's going to the Air Force to make the commencement, right?
Yes, sir.
Oh, I think it's great. I think it's great. If he's going to make the commencement, I hear they're going to have a very spread out crowd.
Yes, sir.
They're going to be, I will say, they are going to be socially very good. They're going to be very far apart. That'll be very interesting. I think I'm going to watch that one. No, they're going to be, they're going to have a good spread, a good distance apart. I spoke to Mike about it. No, I think making the commencement speech, I'm doing it at West Point, which I look forward to. I did it last year at Air Force. I did it at Annapolis. I did it at the Coast Guard Academy. And I'm doing it at West Point. And I assume they've got it. And I understand they'll have distancing. They'll have some big distance. And so it'll be very different than it ever looked. Do I like the look? No, I don't. And eventually, next year, they'll have a commencement which will be like it's been, like when people like this, our great admiral who's done such a great job, when he graduated from where he graduated, me too, we're nice and tight. And that's going to happen again. I don't want people to think that this is going to be like this forever, but for a period of time, we're going to have to keep it that way. That includes baseball games and football games and other things. But eventually, as this virus goes away, it's going to be better and better. Direct here, it's going to be better and better, and we're going to get our lives back to the way they were. You know, one thing that bothers me, a couple of restaurateurs called, and they said, I mean, sir, I barely made a living with 150 seats. Now, if I do what they want me to do, I'll be down to 25 seats.
So we believe that the conversation that the president is talking about with these conversations with restaurant owners, these are multimillionaire celebrity chefs, including Wolfgang Puck. President Trump had a conversation with them recently. It is important to note when President Trump quotes someone and says, "Sir, I have to tell you," we have been able to document that more often than not, it is a false story. Regarding this governor of Virginia taking people's guns away, I want to just give you a little bit more information on what President Trump considers taking guns away. The law that the governor signed does not take anyone's gun away. It requires universal background checks on gun purchases, something that roughly 92% of Americans across party lines support. He signed a bill that requires red flag laws that enables family members to highlight when they think that someone might be a danger to themselves or others, and a limit that limits the number of handguns a person can purchase to one a month. That seems pretty reasonable. Who needs many handguns a month? It's not taking the guns away. It is another ridiculous, false argument.
With China, let me just put it this way. I'm not happy, okay? I'm not happy. And I spoke to them, and this could have been shut down a long time ago. They knew it, and we couldn't get in, and in all fairness, World Health couldn't get in, and that's why I wish they took a different stance. They took a very pathetic stance and a very weak stance, but they say that...
President Trump keeps changing whom he blames for this pandemic. He's now saying that it was China, that they kept us out. I just want to highlight that throughout February, President Trump was praising China. He said, let's see, the best one was on January 24th. He said, "China has been working very hard to contain the coronavirus. The United States greatly appreciates their efforts and transparency. It will all work out well. In particular, on behalf of the American people, I want to thank President Xi."
Virologists look at the sequences there and the sequences in bats as they evolve, and the mutations that it took to get to the point where it is now is totally consistent with a jump of a species from an animal to a human. So, I mean, the paper will be available. I don't have the authors right now, but we can make that available too.
Follow-up, sir, on the protests that we've seen of people wanting the economies to open. Does that concern you, though, as a health expert, when you see folks congregate, and are you worried if that's encouraged?
Well, I mean, I'm looking at it from a public health standpoint. I certainly can understand the frustration of people, but my main role in the task force is to make recommendations to protect the health and the safety of the American people. And I would hope that people understand that that's the reason why we're doing what we're doing, and hopefully we'll put an end to this.
Thank you. So Dr. Fauci appears to throw cold water on the conspiracy theory that this disease was created by a lab in China. That is a theory that this administration seems to be leaning into, but it is not what the science seems to point to.
If we didn't do what we did at the time, we could have lost more than 2 million people. I really believe that. I could show you charts of other places that gave it a shot and they're not doing well. And I would show it to you right now. I don't want to embarrass anybody.
The president suggesting that other countries are doing less well than the United States, I just need to say again, the U.S. has more cases than any other country, more cases than the next 4 countries combined, and more deaths than any other country. The U.S. accounts for roughly 30% of the world's cases and 20% of the world's deaths. I don't know what country the president would show as an example of who's doing worse.
Not working out very well. Now, with all of that being said, we have to get back to work. We'll be crossing lines very soon in many cases. In some cases, we're well on the way down. In other cases, we're right at the top and heading down. We're heading in the right direction. I saw some numbers from New Jersey, which was having a very tough time. It started. He's doing a terrific job, the governor, Phil Murphy, starting to get some really good signs. I looked at some of the New York numbers. They're starting to get, they've been devastated, obviously, but some really good things are starting to happen. So if we would have done something different, first of all, it would not have been sustainable. You would have had people, they would have been furious at you and me and everybody up here. It would not have been sustainable. Because you look at some of the hospitals as an example, a certain hospital right near where I grew up in Queens, and you had body bags all over the floor of that hospital. You know the one I'm talking about. All over the floor of the hospital. Now multiply that times 12 or 15, because that's the kind of numbers you're talking about, 12 or 15. And it would not have been, there would have been an insurrection. Nobody would have understood that. Whereas right now, nobody can be blamed, and there is no blame.
The president has tried to blame many people. The president has, in this briefing, blamed China. He has blamed the Obama administration. And in previous briefings, he has blamed the World Health Organization. He has blamed governors. So it is very striking to hear him suggest that there is no blame.
What we did was the right thing. With that being said, we want to get back, and we're going to be opening up states. They're being opened by very capable people. It's also point of sale, as they say in a different business. It's the point they'll be able to look at that, where the testing is taking place. We're going to help them with the testing. We've developed some tremendous tests over the last little while, and we're going to work with the states, and we're going to help them. But they know every inch of land in their states. I watched the governor of Arkansas, Asa. You saw that. I thought he was terrific. I watched the governor of Oklahoma over the weekend being interviewed. He was terrific. They've done it a little bit differently, and they've done.
Arkansas and Oklahoma have done it differently. They've had fewer restrictions in place, and in the past week, Oklahoma has had a 53% increase in cases, and Arkansas has had a 60% increase in cases.
And I think with that, we'll see you tomorrow. But really, this has been a situation where a lot of great people have been involved, and a lot of great decisions have been made. Thank you all very much. Thank you.
The president will be a brief evening. Let's see if they're going to take any other questions.
We do have quick follow-up with Administrator Burma. Could you take a question?
Dr. Fauci, Instagram.
Or for the doctor.
Nursing home desk, Administrator Burma.
All right. So reporters had a question for the CMS Administrator, Seema Verma. This is a nice wide shot where we're getting to see some of the paraphernalia that is kept on that top shelf that you don't usually get to see. That's rather nice to see for a moment, but we didn't get it for long. One of the things that was highlighted there, reporters had a question for Seema Verma, and she was part of this briefing that has gone on for roughly 2 hours. She is a high-ranking figure in this administration with a lot of work to do, and she appears to have been brought there merely as a prop, not invited to speak at all. It was the same thing that we saw with Dr. Birx at a press briefing earlier this week. So that appears to be it for today. This caps up a week of really startling statements by the President of the United States. Again, earlier this week, He said that his authority as President of the United States was total. He said that he would cut off funds to the World Health Organization. He threatened to adjourn Congress and govern the nation on his own. And then today he tweeted out highly incendiary tweets urging people to more or less rebel against the governors in states that are working very hard to control the spread of the coronavirus. In this briefing today, he suggested that the governor of Virginia should be under siege. I believe under siege was the word that he used for his signing bills into law requiring universal background checks. So it has been really a heck of a week of statements from the president. Thank you for joining us. Again, I am NowThis senior politics producer, Alan Piper. I had support from our full team today, including Brandon Caruso, Maddie Green, Kavish Harjai, Michael Lester, Scout McEachran, Ian McKenna, and Versha Sharma. In the time that we have been in this briefing, the number of cases in the U.S. has gone up. At least roughly 7,000 more cases have been confirmed within the U.S. The number of global cases crossed 2 million this week. In New York, it was a particularly sobering week where New York had to reevaluate how it was drawing its death tolls and begin counting a number of people who appeared to have died from coronavirus at home without being diagnosed in a hospital. And as a result of these updates, New York City now believes that the death toll is over 13,000. Here in the East Village, I know that just up the street at Bellevue Hospital, there are around 11 refrigerated trucks parked outside the hospital to accommodate the overflow of bodies from the morgue. So these are very disturbing, serious times. If there is a briefing tomorrow, as the president suggested there will be, we will be here to cover it. In the meantime, please stay safe. Please take care of yourself. Check in on the people you care about. And please don't let another day go by without making sure that the people you love know how much you love them. We will get through this thing together. Thank you and good night.